question, sir.
The question is, would a Democrat want to propose something like going back to national conscription and raising another 4 or 5 divisions in the Army in return for national health care? You know, a WPA type program, you work roads and health care, or you do the Army in return for real national health care, single payer health care.
Okay, we'll begin with Mr. Richardson.
Well, since the issue that you predicate the whole thing is upon single-payer health care, although I'm not in favor of 676, it's not because of economic reasons. I think it makes perfect economic sense. I don't think we need to have a trade-off, the sort of thing where we now provide free education to our soldiers and so forth. That's an appropriate sort of thing to do. I don't really think we need a conscription, nor do I think it would be politically feasible. I also don't think that single-payer health care insurance at this point would be politically feasible. Again, I think it makes perfect economic sense, but as a result of the 250 million people that have some form of insurance, some of whom are happy with it, I think that by and large we would be scaring or creating fear in some portion of the population in order to help the 50 million people who are uninsured or poorly insured. I don't think that's going to happen. But again, health insurance is not an economic problem, it's a political problem. I don't think conscription would help that.
Okay, I think he was talking about, this is a follow-up question, about would you consider national service as a way to pay for health care? Am I right, Mr. O'Brien?
No, I mean, I'm talking about a true New Deal, a bargain, a compact with the American people. You know, health care, national health care, get it off the backs of business, free up business from that.
In return for some kind of national service that you would
National
give.
service.
Well, my feeling is that national service is a good idea for a variety of things, whether it be the Peace Corps or local service in the rural community, any number of things. I'd like to see things done for returning veterans, for injured veterans. I can think of a number of programs that would be useful. But again, I see them as independent of health care. I think if we eliminate the costs of third-party insurance right now, we can pay for health care. There's no problem with paying for it. We don't need a bargain with the American people in order to pay for health care. We need a more educated populace in order for that to happen, because that hasn't happened yet.
Yeah, I'm not saying pay more for health care. I'm saying we need to spend less for health care, but
Thank you. Thank you. Mr. Rousseau will give you an opportunity to answer that.
In your question, you had talked about New Orleans, and I had the pleasure, unfortunately the pleasure, but I went down to New Orleans a couple of months ago and toured the 9th Ward and saw what our nation has done, has left people behind. We left so many people behind. I'm very disappointed to hear some of the comments from Mr. Richardson. It's not 50 million people, okay? It's over 100 million people. 47 million people are uninsured, but an equal or more amount are underinsured. Nearly 1 in 3 Americans are either uninsured or underinsured. This is a serious problem. And what we need are leaders that have the guts to be able to say what needs to be said even when it's not popular. I understand talking about a national health care plan, which is actually different from socialized medicine. And I'm not advocating necessarily for socialized medicine, but a national health care plan is not the most popular choice in the world. That's why I found a good compromise in H.R. 676, where every man, woman, and child will have health care coverage. But we can sell it to all Americans because it's privately delivered and you keep your freedom of choice. So it's publicly subsidized but privately delivered. This is a problem that we need to address. And I do believe that that's a great idea. Trying to, in Germany, again, for example, you can go and either be in the military for, I believe, 11 months, or give 10 months of civil service, or maybe I have those numbers inverted. But I think that that's a great idea in order to be able to help subsidize the increased costs that we will incur by trying to cover health care.
Thank you, sir.